Thank you, everyone, for being here. We'd like to begin by acknowledging that the land on which we gather is the traditional unceded territory of the Ouellet and Mi'kmaq peoples. This territory is covered by the treaties of peace and friendship, which Ouellet and Mi'kmaq peoples first signed with the British Crown in 1725. The treaties did not deal with the surrender of lands and resources, but in fact recognized Mi'kmaq and Ouellet titles and established the rules for what was to be an ongoing relationship between nations. I am grateful for the opportunity to work on this land today and every day. You may live and work in different territories, so I encourage you to reflect on the land on which you are located and to consider your relationship to that land and to the people who are the traditional keepers of that land. So thank you, everybody, for being here. My name is Lyne Ouellet, and to let you know a little bit about myself, I'm currently in my second year at UNB, completing a PhD in interdisciplinary studies with a focus on health and aging. I'm also a research coordinator with St. Thomas University, which is also in Fredericton, New Brunswick. And we're piloting a community connector program within the Healthy Seniors Pilot Project program. We're hoping to connect older adults to health and community services by training anyone and everyone that may come in contact with an older adult. I'm also a former inpatient physiotherapist, so I'm moving forward in this new direction in my career with some experience in the healthcare system. I'm the 2021 recipient of the AgeWell NBHRF Graduate Student and Postdoctoral Award in Technology and Aging. I can't say enough how many doors this opened to some great opportunities as I'm shifting into this career in academia. I'm now a graduate of AgeWell's Innovator of Tomorrow certificate program, which gave me valuable insights into the aging process, ethical considerations in research, understanding policies and practices in Canada's healthcare system, and a deep understanding of the design and innovation process and the context of technology development and commercialization. I've been able to present virtually and in person at a number of conferences hosted by AgeWell, and I attended their Summer Institute just this past summer, held in Prince George, BC, and co-hosted by the Centre for Technology Adoption for Aging in the North. I'm one of their Policy Challenge recipients this year, and another one is Ashley Ann, who will be presenting later on today. With this, I've been mentored by the capable team of APPTA, who are here as well today, and you'll be hearing from them. And I've had a one-on-one session with a government stakeholder, another invaluable connection facilitated through this network. I'm finishing a policy brief related to some of the work I'm doing, which will be published on APPTA's website, but it's also going to allow me to present to their government stakeholders from across the country in March, an extremely important connection that I really look forward to. I'm on AgeWell's HQP Advisory Committee, and within this, I sit on the Knowledge Translation Subcommittee. It's allowed me to be a part of some great AgeWell initiatives, planning some AgeWell events, including today's event, and has really allowed me to get to know some other great students and people who are doing really interesting work across our country. I want to thank you all for attending today's showcase on some really great work being done here in our Atlantic provinces. We're very fortunate to be able to be here through the support of AgeWell, as well as NBHRF. I can say that today's event would not have been possible without some key members of the AgeWell team, namely Dr. Samson Dassey, Alison Schneider, and Alexandra Fournier. Thank you so much for your time and expertise in putting all of these pieces together so we can hear from all of the great work that's being done and for us to be able to network within this session. So to situate ourselves for this session, it's helpful to know that by 2035, Canada will be considered a super-aged country, where 1 in 4 Canadians will be older than 65 years old, according to Stats Canada. In fact, the number of Canadians aged 85 will triple by 2051. This is definitely one of the greatest achievements of science, education, and social development, but it'll also be one of the biggest challenges we have as a nation as we move forward. The rapidity of our population aging also presents quite a challenge. While the population is healthier, generally with increasing age come differences in capacity to conduct activities of daily living and an increased number of chronic conditions. Our infrastructure is currently unprepared to support the needs of vast quantities of older people. Canadians over 65 accounted for 45.7% of total healthcare expenditures in 2019. Given the StatsCan population projections, individuals aged 65 and older will account for more than 71% of total healthcare expenditures by 2040. And even if you're healthy, according to an RBC survey, the out-of-pocket healthcare expenses for someone over 65 is about $5,700 annually, almost double what people thought they would spend. Without immediate and sustained interventions that will empower all Canadians to work, live, and age with dignity and autonomy in the place of their choice, this demographic shift will pose unprecedented challenges. So what is AgeTech? Well, AgeTech is technology that can improve the lives of older adults. It can provide a way forward. There is immense potential for us as researchers and as future leaders in this space to make real, sustainable, positive impacts in the lives of older adults and caregivers in Canada. Over the past 2 years, because of the COVID-19 pandemic, we've seen the potential for apps, the Internet of Things, wearables, remote monitoring, communication technologies, virtual care, and other digital solutions to enhance health outcomes. Our work, however, is nowhere near complete. In Canada, we have a population of older adults who are, for the most part, comfortable with existing technologies. An AgeWell poll found that 76% of older adults 55 and above self-reported being confident using current technology, and that almost 70% were willing to pay out of pocket for technologies that would allow them to live at home longer. The provincial and federal governments have recently made significant investments in digital health, and we are seeing increasing infrastructure to make digital health solutions a reality for more and more Canadians. The time is now for us as innovators to work with older adults, caregivers, clinicians, and other stakeholders to build and implement solutions that can support our growing population of older adults. This showcase will highlight the work of Atlantic Canadians who are working in the AgeTech field. Almost 1/4 of Atlantic Canadians are over 65. How can AgeTech support healthy and independent living? AgeWell is pleased to host this exciting series of presentations on the work being done here in Atlantic Canada. So what is AgeWell? Well, AgeWell is a federally funded network that brings researchers, industry, government, older adults and caregivers, clinicians, and future innovators in the field to bring AgeTech to those that need it. With our partners, such as NBHRF, we support research on the needs of older Canadians and their caregivers and fund tech and service development. Through our innovation hubs, like APPTA, who you'll hear from, we help translate research into policy. We support startups and train undergrads, grad students, postdocs, clinicians, and research professionals in over 100 colleges, universities, and researchers across Canada. So how do you get involved? Well, I encourage you to get involved. If you're a researcher, AgeWell currently has some open calls for 1-year research grants. And entrepreneurs can apply to be part of the Startup Affiliate Program and receive in-kind supports. Just email info@agewell to learn more. Now, if you're a graduate or postdoc, AgeWell and APPTA scholarships and awards will open in April, and I highly encourage you to apply. There's even an affiliate membership program for students, postdocs, and clinicians that will provide free access to AgeWell programming, internal funding, and help you stay up to date, everything happening in the network. Email the training email, training@agewell, or go to the link you see here to apply for membership. So without further ado, let's start the showcase. We have 5 short presentations which will highlight regional projects in the first hour. There won't be questions after these, but do write them down and hold on to them, because after this will be followed by 30 minutes of networking to build out further collaboration in the space across the provinces. The presentations will be recorded and available on AgeWell's YouTube channel. So our first presenter today, I'm very happy to introduce, is Jenna Roddick. Jenna is the Manager of Operations for the APPTA Hub. She oversees APPTA's day-to-day activities and programs and leads collaborations with government, researchers, and other organizations that serve the aging population. A key role for Jenna is to identify relevant research being done across the country that aligns with current government priorities in aging and APPTA's effort to contribute to evidence-informed policy recommendations. Another part of her work is to promote knowledge translation through partnerships, the Mileage podcast, and APPTA's education programming. So without further ado, I welcome Jenna. Thank you.
Thank you so much, Lynn, for the introduction and the land acknowledgement. I too am residing in Fredericton, New Brunswick. Is my screen sharing the appropriate screen just before I continue?
Yes.
Okay, perfect. Well, again, thank you so much. So I'm here representing and providing an introduction to APPTA. APPTA is an AgeWell National Innovation Hub, also co-funded along with AgeWell with the New Brunswick Health Research Foundation since 2017. And APPTA stands for Advancing Policies and Practice and Technology in Aging. So in this presentation, I'm going to go over who we are, what we do, what we've done, a little bit about our operations in the last 5 years and why we do that. So I'm very delighted to be providing you with this introduction today. Like Lynn said, I'm Jenna, Manager of Operations, and this is our team with a couple of missing photographs. And our scientific director is also here today, representing his role with the MSSU, Dr. Daniel Dutton. So our vision is to drive policy innovation that improves the lives of older Canadians. And over the last 5 years, we kind of established 3 core pillars of our work that aim to accomplish this. So as I said, we were established in 2017 as a way to enhance the use of research evidence in policy decision-making and practice. So I'll get into the difficulties that exist in this space with that in the knowledge translation gap, but we aim to bridge that gap first through knowledge translation and looking for the most recent and relevant research evidence that addresses policy topics of interest and of need to our government network. So through research partnerships, knowledge sharing opportunities, such as webinars and targeted presentations and workshops, our podcast and blog. Secondly, we have a network of government stakeholders and offer opportunities for connection and knowledge sharing through the platforms mentioned under Knowledge Exchange. And we offer these opportunities so they can learn from each other, discuss similar challenges, successes, and lessons learned in a safe space for government stakeholders to relay information that they may not be able to relay publicly, just to accomplish a sense of knowledge sharing in this space. And then lastly, fostering innovation is centered around our education programs, like Lynn touched on. We offer opportunities for early career researchers to develop policy analysis skills that they don't typically get exposure to in post-grad curriculum. So our Pep Talks webinar series is a virtual learning series that culminates in writing a policy brief, the Visions for Change Policy Challenge, which culminates in a policy report and presentation to government, along with mentorship opportunities, as well as some general introduction webinars, education webinars that we do on a kind of recurring basis as well. So our work so far has been driven by our prioritization process, and this is how we try to aim to bridge the gap. We have a process to select topics that require research evidence to inform what governments need to know. So we explore what is known about the issue. what work is ongoing, and are there opportunities to collaborate and build stronger connections and networks? And then, of course, has government established financial commitments or priorities within their strategies on these issues that aging adults experience? So these are the topics that we've tackled to date. So they range from digital literacy to supporting caregivers and enhancing the health technology adoption and scale in New Brunswick, for example. And then over the last 2 years, we've selected these 5 topics. So virtual care delivery, alternate housing and care models, social isolation and loneliness, recruitment and retention. So we're currently seeking those research partnerships that was on the previous slide, and continuing to look towards our research network and who has ongoing work and expertise in these areas to connect our research and government network together and build that strong connection between research and policy. And just quickly on why we do this. So policymakers and researchers don't always speak the same language or have the same skill sets and capacities. So oftentimes there's a disconnect between what research is saying and how it can translate into the policy context. And then timelines and processes don't always align. Whenever something is on the policy agenda, research timelines don't often cater to that quick pace, and vice versa. Whenever research is ongoing, it may not be on the policy agenda. So there's disconnects and silos in these spaces, and this is really why we do what we do, and we aim to build those connections and keep them strong, so that whenever things are of priority and research is ongoing, those connections are there already. And lastly, one of the core ways we do that is within our fostering innovation pillar. So we aim to support early career researchers in understanding policy development through our education programming, providing hands-on experience with policy analysis, and through the exploration of issues through a policy lens, how research can really connect to the policy context. And we offer opportunities for mentorship, opportunities to present in front of government stakeholders and elicit feedback from them. And ultimately, our education programs help develop policy products like briefs and larger reports and presentations to translate what research can mean for policy decisions. And that's a brief overview of APPTA. And my contact information is here, but it's also, I believe, shared within a Google Doc if you have any follow-up questions. And I will be in a breakout room as well for any follow-up questions and networking.
Thanks so much, Jenna. Very exciting. And yeah, for anybody who gets to meet Jenna, certainly ask away on your questions. Thank you. So up next, we have Ashley Ann Marcotte. Ashley Ann's presentation title will be Engaging Older Adults in AgeTech Solutions, the OA Involve in Smart Tech. Now, Ashley Ann is the research coordinator who's working with Dr. Susan Kirkland at Dalhousie University. She'll be discussing the OA Involve in Smart Tech projects at Dalhousie. Ashley Ann holds a master's degree in community psychology from Wilfrid Laurier University and has a background in community-based research. She's an advocate for community and partner engagement throughout the research process and strives to elevate the voices of older adults and marginalized groups in research. Thanks, Ashley Ann.
Thanks, Lynn, for that introduction. Hi, everyone. As she mentioned, I'm Ashley Ann. I'm an AgeWell HQP and research coordinator for Dr. Susan Kirkland's OA Involve and Smart Tech projects. Before I get into who we are and what we do, I want to acknowledge that these are both AgeWell funded projects. The work we do would not be possible without their generous support. Smart Tech is a current core research project which began in 2020 and will be running until March of 2024. OA Involve began as a core research project during the first phase of AgeWell in 2015 and is now merged with the network as a cross-cutting partner to provide support and resources for user-driven research. So who are we, what do we do, and why is it important? OA Involve is both a research project and an advocacy group. Our goal is to establish models of best practice for the active involvement of older adults in aging and technology projects to support technology development that is transdisciplinary and fit for purpose for improving the independence, health, well-being, and quality of life of older adults. The key idea here is really the active involvement of older adults, because we know there is a spectrum of engagement from participation to advising to co-production. We believe that the more involved and the more active that engagement, the better. We can rely on research all we want to guide us in production of technology, but there's no better source of information and guidance than the lived experience and personal knowledge that end users can provide. While Susan and I are located in Halifax, Nova Scotia, our team is actually a national team with members in Toronto, Guelph, and Red Deer, Alberta. We also had some former members in Vancouver. The team consists of a group of academic researchers with expertise in participatory research, community engagement, and healthy aging, and who have a vested interest in improving the quality of life of older adults. Along with the researchers, we have the Older Adult Research Partner Group, or OARPG. The OARPG consists of a group of older adults who are interested in sharing their experiences and providing guidance as we co-create reports, documents, and presentations to advocate for the engagement of older adults in tech research and design.
Okay, I think what is it? Like, is it
a few quick examples of what we've produced include these comics that were led by the OARPG to break down stereotypes and give tips on the most important things to keep in mind when working with older adults. These were printed on postcards and bookmarks and disseminated at the 2019 AgeWell conference in Moncton. We've also developed reports designed to make it easier for researchers to engage with older adults, including a guide to establishing and coordinating an older adult advisory group, tips and solutions to barriers and facilitators of engaging people living with dementia, as well as guidelines and advice for older adults who are interested in becoming involved in research projects. We did have a small hiatus in 2020 due to COVID, but we have recently picked up again with a focus on sharing older adults' perspectives in engaging in research. We presented a video at the 2022 AgeWell conference in Regina, where our OARPG shared their themes they thought were most important for researchers to know when working with older adults, including the importance of building trust and rapport, having check-ins, and providing feedback. Going forward, we are looking at producing a manuscript with the OARPG to share their perspectives with a broader academic audience, as well as producing additional videos with tips to make engagement easier for everyone involved. Additionally, we are happy to meet with other groups to answer questions, give insights, and have discussions about older adult engagement. Our other major AgeWell project is the Living More with Smart Technology, or Smart Tech project. It is a real-world transdisciplinary research partnership led by Northwood Continuing Care Homes in Halifax and our research team. Our national and international academic, non-for-profit, and industry leaders, together with older adult advisors, are exploring how smart technology might improve health and well-being for people living in long-term care and receiving home care. We seek to understand the experiences, needs, and desires for well-being among this group of older adults aging with disability, as we build and test a new smart tech service that combines customized smart technology, person-centered assessment, and rehabilitation supports. Our goal is to enhance autonomy, independence, and well-being for these individuals. We also want to understand the impact of this service on these older adults, their caregivers, and care delivery, and understand the needs for sustainability and scalability. The service we built consists of providing Northwood long-term care residents and home care clients with Google Nest Hub Max devices and proprietary technology to allow residents to use their voice to perform tasks, access information, entertain themselves, and control their environment. We've also implemented a rehabilitation support team, which consists of an occupational therapist and rehab assistants who support the long-term care participants as well as the implementation of the research. They provide ongoing training, troubleshooting, and support to use the technology and incorporate it into the day-to-day lives of participants. In order to understand the impact of this service in both long-term care and home care, we engaged in qualitative interviews and quantitative surveys with a spectrum of stakeholders, including long-term care residents and staff, home care clients, and their informal caregivers. We also interviewed Northwood administration to understand the policy, practice, and programming impact our service could have for the organization as a whole. We're currently in the process of wrapping up data collection and beginning data analysis. As I mentioned previously, Northwood is the host and continuing care partner. They are the largest non-for-profit continuing care home in Nova Scotia. We have a unique collaboration set up that allows us to co-learn and co-develop in real time. We've situated our research staff on site for data collection with the support of the rehab team, who also contribute contextual knowledge during research meetings. This transdisciplinary collaboration has allowed us to shorten the research to practice gap, as Northwood is able to directly learn alongside the research team and use our learnings to impact practices, programs, and future research endeavors. Our Community Advisory Council, which is made up of older adults, caregivers, and Northwood residents, also helps guide our work and focuses us to ensure that we keep the needs and desires of older adults aging with or into disability as a priority. Although we are only beginning our data analysis, we have learned some very interesting lessons throughout the past 3 years. One of the most important findings is the importance of social supports and infrastructure. We began this journey with the idea that technology and the possibility it provided in terms of autonomy and independence was the focus of our work. However, we've determined that the technology doesn't really matter without the social supports to help participants use it and strong enough networks and infrastructure to support its use. We also know that technology is always changing and evolving, and in order to make any sort of technology-based program sustainable, these continuous supports are necessary. Additionally, we know that this will require changes to funding structures and policies, as IT supports are often not covered in continuing care budgets. So that's just a quick overview of our 2 projects. If you're interested in any of the reports or resources I've mentioned or want to learn more about either of these projects, you can visit our websites at livemoresmarttech.com or oainvolveagewell.ca. And you can also reach out to me by email at ashleyannmarcotte@dell.ca. Thank you.
Thank you very much, Ashley Ann. I've actually seen Ashley Ann present at that 2022 conference. And I really do see that they live and act upon their belief of active continuous engagement. So I think there'll be some great conversations in that breakout room. We have Justine Henry coming up next. Justine is a part-time PhD student at the University of New Brunswick and also works full-time as the Executive Director of the Center for Innovation and Research in Aging, or CIRA, a not-for-profit research company housed within New Brunswick's largest long-term care facility. Justine has an honors degree in psychology from Mount Allison University, a diploma in health and wellness and recreation from Eastern College, and a Master of Science in kinesiology from the University of New Brunswick. Previously, she has worked as a researcher in many fields, including behavioral psychology, adulthood and aging, chronic pain, and human sexuality. Her presentation title is the Center for Innovation and Research in Aging, Research Driving Practice. Thank you, Justine.
Awesome. Can everyone hear me and see my slides okay?
Yes.
Awesome. So thanks so much for the introduction, Lynn. I'm so happy that I was given the opportunity to talk more about CIRA and one of our exciting research projects that we're currently working on. So who are we? The Center for Innovation and Research in Aging, or CIRA for short, is a not-for-profit research organization housed within York Care Center, which is New Brunswick's largest long-term care facility and is located in Fredericton, New Brunswick. CIRA was officially incorporated as a not-for-profit business in the spring of 2018, just shortly before I started working here. Since then, we've been successful in obtaining nearly $3 million of research funds dedicated to improving the quality of life of older adults. And I'm very happy to say that my team has grown from a team of 2, myself included, to now a dedicated team of 12 research staff. This past November, we planned, organized, and hosted an aging care and research symposium in Fredericton. We were happy to host a variety of guest speakers, exhibitor booths, and nearly 300 attendees who all share an interest in aging care and research. Here's a photo of my awesome team who worked so hard to pull this event together. And honestly, there's no way I would have stayed sane if I didn't have their help. Plans are already underway for this year's symposium, so stay tuned for updates on when and where. And also, if anyone's interested in being involved in any capacity, either planning, presenting, exhibiting, or sponsoring, please don't hesitate to reach out to me for more information. Over the last few years at CIRA, we've also broadened our partnerships and collaborations. We currently have networks across the country, which include community organizations, industry partners, academic partners, as well as funding agencies. Currently, we're working on a total of 7 Healthy Seniors pilot projects. From round 1, we were funded for a project assessing the impact of a home-based or facility-based virtual reality exercise program. Round 2 brought in funding for 4 new projects. The first one being Can Immunize, which is a vaccine management application designed for older adults and their care partners. Also a project focused on online palliative care education for long-term care staff. 2 Race With Me, which is a standalone hand and foot peddler that, when used, navigates residents through augmented reality travel videos. And Med Reviewer, which is an app co-created by CIRA to aid healthcare providers in deprescribing potentially inappropriate medications. In the most recent round of funding, we were successful for 2 projects, Passive Aware, which is a sensor-based technology to aid community-based informal caregivers and their loved ones who are experiencing memory loss, and Genie, which is a project I'll be discussing in more detail today. So Genie is an exciting initiative that came to light in early 2019, where an initial pilot trial was conducted with a subset of residents at York Care Center. After a few years of development, CIRA and Ambient Activity Technologies, the co-creator of Genie, decided to pursue funding for a larger New Brunswick-based Genie trial. So before I get into what Genie is, let's look at why there's a need for Genie. As people age, their social ties tend to weaken, with fewer opportunities to remain connected with family members and friends. In many rural areas, such as those in New Brunswick, family members may live far away and are unable to visit as often as they would like. An increasing sense of isolation and deteriorating mood may compound mild cognitive decline that can occur with normal aging or with disease processes such as dementia, which further threatens cognition. This, in addition to the visitation restrictions during the COVID-19 pandemic, has significantly worsened feelings of social isolation and loneliness for those living in long-term care. Although communication platforms such as iPads, FaceTime, Skype, or Zoom are all viable means to stay connected with the general population, a substantial segment of the population living in long-term care facilities are not able to independently navigate these technologies. Additionally, due to scheduling conflicts between family members, residents, and supportive staff, it can be challenging to facilitate real-time virtual visitations between residents and their family members. So what is Genie? Genie is a kiosk unit that consists of the Genie interface and a flat screen monitor. The Genie interface has large colored buttons, including a volume control and a familiar corded telephone handset. The messaging buttons consist of an up arrow and a down arrow for navigation, and a green go button. The colors coincide with the images and prompts that appear on the screen while Genie's in use. Currently, Genie is housed in an easily accessible space in all long-term care facilities in our study, but Genie is also built onto a mobile kiosk that can easily be brought into individual residents' rooms if they're experiencing mobility issues. Genie is also made with bacterial-resistant materials and can easily be disinfected. As I mentioned, Genie was co-created with ongoing feedback from residents during the pilot trial in 2019. It was designed with older adults and their family members in mind. So how does Genie work? Essentially, there's 3 core components. So family members and friends can send content to their loved ones using a dedicated Genie app that is available for mobile devices. Messages can be audio or text and can include video and picture attachments. At their own time, a resident can approach Genie with an individual access key that loads their custom profile. They may view a message, respond to a message sent to them, or initiate a message to a family member or friend. The telephone receiver, once picked up, will prompt the resident to record and send voice messages. Additionally, messages and photos are saved in the resident's own memory album and can be revisited and viewed at any time. Family members can also access the Genie webpage to upload content directly to residents' memory albums. For this project, Genie is currently deployed in 5 long-term care facilities across New Brunswick. Each site will be using Genie for a 6-month intervention period. We also have a subset of 5 long-term care facilities that will serve as a control group. But I should add, every single home is going to receive a free Genie unit and free training at the end of the study. A variety of interviews and surveys are being conducted before the implementation of Genie, during the trial, and after the trial has ended. The goal of the study is to first evaluate the impact of Genie on social isolation and feelings of loneliness from residents living in long-term care, and second, to assess the feasibility and use of Genie by family members and long-term care staff. So I just want to provide a little snapshot of some of the Genie usage from the 5 long-term care facilities currently participating in the study. So currently we have 33 residents actively using Genie, and in fact, some of these residents are using Genie multiple times a day. And we also have 76 family members or friends who've been connected to their loved one using the Genie mobile app and who are regularly sending content. For the month of January, there have been a total of 106 photos, 49 texts, and 6 video or audio files sent by family members or friends to their loved one living in long-term care. From the resident user perspective, Genie has been accessed 105 times, and residents have sent 50 voice messages to their family and friend users. So what's next? We're set to wrap up the intervention phase by the end of June and start our data analysis. We are anticipating positive results based on the feedback we are receiving, and we'll be excited to share our learnings with many of the long-term care stakeholders. I'd also like to add that we're piloting another iteration of Genie on one of our memory care units at York Care Center. This Genie has been built into a telephone booth kiosk, and depending on the safety requirements of the unit, can be locked and made accessible only by staff and family members. We have been training staff on using Genie and are assessing its use as a tool to help in the de-escalation of behaviors or some of the challenging behaviors that may be experienced by individuals living with more advanced dementia. Families have been encouraged to send calming messages to their loved ones, which are saved to the Genie memory albums and can be accessed by residents and staff when needed. And so far, we're hearing very positive feedback. So thanks to everyone for their time today. I'm excited to connect during the breakout sessions. Feel free to get in touch with me anytime, either by visiting our website, emailing me personally, or reaching out via social media.
Thanks so much, Justine. Wow, so many great projects and ideas, and I'm actually really excited to hear the findings from Genie. There's already great information coming out of it, obviously, so that's really cool. Thanks. Appreciate it. So next we have Carol Goodine. Carol is the project lead for the Hospital to Home Pharmacy Project, an applied research project at the Dr. Everett Chalmers Regional Hospital in Fredericton, New Brunswick. She's a licensed pharmacist in New Brunswick and maintains a clinical practice on the Healthy Aging and Rehabilitation Unit at the DEC and participates in antipsychotic review rounds on the Transitional Care Unit. Carol's research interests include inpatient medication management, deprescribing in long-term care, and pharmacy practice. After several years of practice, Carol obtained her Doctor of Pharmacy degree and completed a postdoctoral fellowship with NBHRF and AgeWell. She continues to be involved in the project that launched her research career and is looking forward to sharing her AgeWell journey and the AgeTech research she's conducting. So she's here to present her AgeWell journey. Thanks, Carol.
Thanks, Lynn. I don't think I'm sharing yet. There. Can you see my slides now, everyone?
Looks great.
Good. Thank you. So it is a real pleasure to be here, and what you're going to hear from me over the next few minutes is probably similar to what you've heard from some of our other participants. I'd like to share my AgeWell journey and my experiences with AgeWell, and not only remind you that yes, they provide funding, but I think there are a lot of other advantages to participating in the AgeWell network. Really, I want to showcase how they facilitate collaboration and co-design, supporting their members and encouraging relationships. And I'll also share some information on the AgeTech projects that I've worked on in the past 5 years. So like Lynn and others, my journey with AgeWell started as a recipient of an AgeWell funding award. So in January of 2017, I received a postdoctoral fellowship award, which was a collaboration or co-funding between the New Brunswick Health Research Foundation and AgeWell. And this is what really allowed me to pursue research and to focus on dedicated time to developing technology solutions to help optimize and improve medication use in long-term care. So not only was the award a collaboration, the postdoc fellowship was also a collaboration. So I was actually housed at York Care Center, which is a nursing home on the north side of Fredericton. And my supervisor was a University of New Brunswick professor. So again, lots of collaboration and lots of relationship building there. Early on, I was also able to attend the Summer Institute, similar to Lynn. Our Summer Institute in 2017 was in Shediac, New Brunswick. So Atlantic Canada hosted and the New Brunswick Health Research Foundation co-hosted. And what an amazing experience. So if you're not familiar with the Summer Institute, what happens is that we're placed into multidisciplinary teams and we're tasked with co-designing a technology solution with an older adult. And in Shediac, the older adults that we participated with lived in one of the local nursing homes. So our job was to talk with the older adult, to find out what challenges, what pain points they had experienced, and then to come up with a technology solution to address that particular problem. So our team had expertise. My background is in pharmacy. We had someone with a background in nursing. We had people with backgrounds in IT and technology, some with experience with government policy. So it really was quite a well-rounded group, and it was an excellent opportunity to learn from others and to work together. What we heard from our older adult at the Summer Institute was the difficulties that they had in finding rehab services after their stroke. So we came up with the idea of a virtual rehab service and pitched that particular product at the Summer Institute. It's pretty amazing to me, all of the different topics that were covered during the Summer Institute and things that I wouldn't normally associate with research. So again, an excellent opportunity to not only practice co-design, but to learn some other skills. And along that same message, not only does AgeWell support members in co-design, but they support members in a number of other ways. You heard from Lynn about the Innovators of Tomorrow certificate. So as an HQP and a postdoc, I was also enrolled in that program and had access to webinars and coaches and mentors in a number of different areas. So I learned things like intellectual property, project management. I was able to learn about business development. I was able to take a course in translational research from the University of Toronto, learn some knowledge translation tips. I did work with APPTA, and Jenna coached me in writing a policy brief and in presenting virtually to government. So all kinds of different opportunities that I wouldn't traditionally associate with research, and really excellent support for membership. And as an affiliate member today, I still have access to a lot of those resources, the webinars, the library of other resources. And I just can't say enough for the resources and the coaching opportunities that were available. The AgeTech projects that I've been involved with while working with AgeWell all focused on deprescribing and improving health outcomes for older adults living in New Brunswick nursing homes. So we started out by working on technology in partnership with researchers at the McGill University Health Center. So Dr. Emily McDonald and Dr. Todd Lee are co-developers of an electronic tool called MedSafer. And MedSafer cross-references your medications with your medical conditions and flags deprescribing opportunities, which really is another way of saying it flags certain medications that are likely more harmful than beneficial in older adults, or that may no longer be needed. So they really should be reassessed and reevaluated. So MedSafer has been used in hospitals, and we wanted to see if it could be used in long-term care. So our first project was to develop the York Care Deprescribing Report. So we looked at a small subset of the MedSafer rules, and we incorporated them into the electronic system that they were already using at York Care. So this was a small proof of concept study to determine if we could use the data that was already being used to provide assessments at York Care Center. Could we use that to generate MedSafer reports? And if we could generate the MedSafer reports, we also wanted to know if the long-term care providers found them useful. So we had wonderful positive results from that first proof of concept, and that led to the development of our second project, which was a polypharmacy application. So the polypharmacy app is a web-based app or a web-based application. And with this project, we were learning about usability testing and cybersecurity, and really linking the electronic records at your care center with the electronic application MedSafer at McGill. We needed to make sure that we had all of the security safeguards in place, and make sure that we could still safely transfer that information back and forth and produce the deprescribing reports for the practitioners, the physicians and the nurse practitioners at the nursing home. So again, a very successful project, positive results. Our prescribers do enjoy seeing the MedSafer for the prescribing opportunities. They use the information that's provided to help guide them and reduce medication use and optimize it. And so that second project led to a third project funded by the Healthy Seniors Pilot Project Initiative to spread and scale to 4 other nursing homes. So we rebranded as MedReviewRx, which Justine mentioned earlier, and we scaled it to 4 nursing homes. This project required increased cybersecurity measures and the added complexity of a multi-site study. But again, we've had really positive feedback from the practitioners, and everyone's enjoying the opportunity to flag those medications and to have some assistance with reducing medication use. And I want to say a special shout out and thank you to Justine and CIRA and the team at CIRA for really taking over where I left off when my postdoc fellowship was completed. They've really taken that MedReviewRx and run with it, and we're just now looking at data analysis and hope to have our final report written sometime soon. So really exciting AgeTech projects in New Brunswick. So last but not least, Age Well, I think you've seen, really encourages relationships and collaboration. And on this slide, you'll see some of the people that I've met along the way. I certainly don't have pictures of everyone. Jenna and APPTA are missing here. And as well, lots of other mentors are missing. Leah Carr from the New Brunswick Health Research Foundation. I think some of you will have a chance to meet her. Definitely key players in all of this. So I can't thank Age Well enough for this opportunity. I've also worked with the New Brunswick Innovation Foundation, with the New Brunswick Community College, with commercial partners such as Missing Link Technology and Momentum, and associations such as the New Brunswick Nursing Homes, and many, many more. So lots of relationship building. And I'm incredibly grateful for all of these opportunities and the friendships. I highly recommend Age Well and the New Brunswick Health Research Foundation. They really launched my research career in New Brunswick. And I look forward to providing further details on my Age Well experience or any of the AgeTech projects that I've been working on in the breakout room. So my contact information is there, and I would encourage you to reach out if you have any questions. Thank you.
Thanks, Carol. That's great. And I can say I've been hearing about some of the projects that Carol's been involved in, and they are having real impact. So thank you for everything you're doing and keep on doing. And I second the Summer Institute. It's crazy, kind of intense, but so many skills and friendships and just absolutely wonderful, wonderful experience. So last but not least, we have Dan Dutton. Dan will be here. The title of his presentation is the Maritime SPOR Support Unit, Capacity Development Opportunities and Youth. So Dan is an assistant professor in community health and epidemiology at Dalhousie University. He is based at Dalhousie Medicine New Brunswick campus in St. John. His current research is focused on social epidemiology and public policy, namely how governments influence or mitigate the impact of the social determinants of health, like low income. Most of his work is quantitative, utilizing large data sets and modeling strategies from economics and epidemiology. I know I'm not saying that word right. His primary interests are population level exposures and their impact on poverty and health, how governments can address those exposures, and the distributional impacts of addressing those exposures. Currently, that work focuses on homelessness, low income, and governmental policy. Dan is also the scientific director of APPTA, an AgeWell hub designed to bridge the gap between researchers and policymakers, with a focus on policy changes that improve the quality of life for older adults. He's also part of the Impart Research Collaborative. He has taught or currently teaches econometrics, statistics, epidemiology, and population health classes. Prior to his PhD, Dan worked for a short time in the Ontario Ministry of Finance, and he has a Twitter that we could provide you. Also want to note that Dan is the proud owner of the Dutton Research Group mascot, Odin. Odin is a St. Bernard whose hobbies include cuddling and sitting on people's laps, eating food extremely quickly, digging up the garden, and getting pats from anyone passing by the house who notices him. Odin slobbers on everything and everyone while trying to steal food, meaning he is banned from most research group meetings, but I think Odin might be with Dan today. So without further ado, Dan and maybe Odin. Thanks.
Thanks, Lynn. You can see my screen?
Looks great.
Okay, thanks. Yeah, I didn't realize I gave you the unabridged version of my bio there. Thank you for running through everything, including Odin. Don't feel sorry for Odin. He's totally fine. I also noted that I didn't include any pictures of people. The pictures were popular, and Carol was sort of sad she didn't include pictures of anyone. I have pictures of nobody. So you're looking very good by comparison, Carol. But Sharon is here, Sharon Scaling is a member of the MSSU who knows literally everything about what I'm about to talk about today. So if I say something and you want more information, of course, email me, but Sharon is your go-to person. Sharon, I don't know if you're comfortable with me just pointing out that you are here. Okay, she's there. So lots of great discussion.
Sure, Dan. That's That's fine, Dan. There's your share thing. That's fine.
Fantastic. Okay. Yeah, for the nuts and bolts of some of the stuff I talk about, it might be easier for you to just go straight to Sharon. But I'll hook you up with her anyway if you want me to be the middleman on what I'm about to talk about. So I'm here to talk about the MSSU, which is an acronym you might have seen and you might not understand what it is. The MSSU is a SPOR support unit. There are many of these in Canada. The M stands for Maritime. It's the Maritime SPOR support unit. SPOR and support are also acronyms. It is a beautiful nested acronym. SPOR is the strategy for patient-oriented research, which highly dovetails with the work that is happening at AgeWell and any of the hubs or affiliated projects, because it is a focus on, to make it an extremely short definition, I'm trying to get us back on track here, research that impacts humans, that humans like to see the outcome of. Of course, there's more nuance than that, but most SPOR work has that element, and it's operationalized by the involvement of patient-public partners, like we've seen in the discussions today, participants in long-term care settings in Nova Scotia and New Brunswick. So it was established in maybe 10 years ago, just successful in its second round of CIHR funding. Nova Scotia was the lead province on the submission. You can tell that these slides were put together by a Nova Scotia person, a lot of Nova Scotia bias around here, but it is definitely represented in all three maritime provinces. I think that Newfoundland might have its own SPOR support unit. Don't quote me on that. If you're from Newfoundland and you email me about this, that's fine. We can talk about that via email, or if you want to contact the MSSU, you just go ahead and try and see what happens. I actually don't know what happens. Most of the funding is entirely matched by 3 provincial level government organizations. These are your departments of health. And the MSSU's purpose is to support evidence-based solutions to healthcare by these 2 broad categories: providing access to existing evidence and supporting the generation of evidence. And supporting the generation of evidence is what we're going to talk about a lot more than the first point, but still here. Who am I? Why am I talking to you? Other than the exhaustive introduction by Lynn, sorry about that, Lynn. I'll send you a shorter bio in the future. I am also the science lead of capacity development at the MSSU, and capacity development is sort of a broad concept of improving people's skills. Let's just put it that way. So the MSSU does take part in the processing and production and rolling out of things like evidence summaries and reviews of the evidence, etc. That is either of priority or requested. But they also support the generation of evidence. And now this can happen in an extremely practical way, like identifying priority topics with large organizations like the Nova Scotia Health Authority, which is, if you're in New Brunswick, it's the health authority like Horizon Health Network or Vitality. The IWK is a large children's hospital, and the Department of Health and Wellness is government Department of Health. And realize those all animated in. We engage stakeholders to refine these research questions and facilitate research teams to undertake priority projects. This is all sort of helping to smooth the transition between different groups in terms of communication, sharing of evidence, underlining the importance of findings, and making sure healthcare systems in particular are enabled to make changes that research identifies as worthwhile. And there are a number of projects. Here's a bunch of them. I think most of these are in Nova Scotia. I'm going to stop sassing about that. I'm just going to say that most of these happen there because there is a lot of networking of large organizations right next to each other. In New Brunswick, there's certainly a lot of connections between the Data Administration Center and the government. But these are just examples to get you thinking about what patient-oriented research can look like. But because I only have 10 minutes and I want to get to the people who might be in the room, I wanted to underline the fact that there is support for trainees in terms of capacity development. We develop capacity. Stakeholders at every level of the MSSU, including trainees, it's probably the most obvious source of support for trainees. It's called the MSSU Training Support Program, and it's essentially a scholarship that you apply for. There's an information session coming up in February. The competition launched yesterday, so you can go click on that link or just Google Maritime SPOR Support Unit student awards, and you'll find yourself there. You can be from any faculty or department. It doesn't have to be a health department. You don't have to be in medical school. You can apply. The research must be health related and patient oriented. I put that in italics because I'll talk about that again in the future. People get freaked out when they see that term. The key is that your supervisor needs to be an MSSU associate scientist. It's extremely easy to become an MSSU associate scientist. You fill out a form, and now I know what you're thinking. You're thinking, oh, great, another form. It's only gonna take 5 minutes. And then when I fill it out, it ends up taking me 4 hours. It's not a hard form to fill out, believe me. And I'm a person who hates forms. Now, you're probably, if you're a trainee, you're saying, oh man, but my research isn't patient oriented. So the MSSU does not expect you to know what patient orientation is, or how to engage it with your research, or how to even make all the connections. As a master's student or a PhD student or a postdoc, you might not have the connections that enable you to do quality patient-oriented research, and that's what the MSSU is trying to help people do. So MSSU provides training on patient-oriented research methods and help connecting with patient and public partners, the very thing you need to put together a competitive application for this competition. So I encourage you to get in touch with the MSSU. You can email and just describe what you're trying to do, and there are people who will get back to you. They're extremely, extremely helpful and knowledgeable. Also on data support, I saw Sam Stewart was on the list of participants. So if you have any data questions, trainees, I encourage you to email Sam Stewart to his personal email address. He would love that. But basically, one of the pillars of the MSSU is health data administrative platforms. Might screw that up. Data platforms, something about data, something about platforms. So in every province, there exists now a data warehouse, essentially, supported by the MSSU. And I think part of that does in some way benefit trainees, either using the data, discounts on accessing the data, or helping you with practical skills. I see I am at almost the limit of my time. I'm going to say this all very quickly. The support for non-trainees, if you're not a student, become an MSSU scientist. I just told you it's a 5-second form. You get some benefits beyond merely the prestige. Access to POR, patient-oriented research methodology and training and resources and connections. I find this to be extremely valuable, particularly when I'm trying to navigate something like research design or grants or teaching how to tell people what patient-oriented research is. I go to the source. And I think this is an extremely helpful resource. I believe that is all. Here are the funders. New Brunswick, right there on the left, beautiful ship. I'm just going to go ahead and say best member of the MSSU, because that is not contentious or provocative point. Thanks, Phyllis.
Thanks, Dan. That was very overall great view. Thank you so much. This has been really good. Some good conversations, I hope, and meeting some new people and making some new collaborations. So I really appreciate all the presenters that took the time today to share your work, your time, and thank you as well for all the attendees. And hopefully we'll keep these conversations going after this. And take care, everybody. Thank you.